Good evening, everyone. Just give me a moment, just waiting for Nicole to join us. So just to remind you, the topic for this evening is find out how we can get our patients to come in for regular massage appointments after the baby has arrived. There she is. All right, so now let me add you. How do I do this? Nicole, how do I add you? It's not giving me the option. Let's see. Let me go over here. Maybe it's from the phone. You know what? I think it might be. And the problem now is I'm live on the computer. So let's see. What do you think? Okay, you know what I think we should do? Maybe we should start and you can add comments and we can see if anyone joins us tonight. And we can do this just a little differently. So just letting you know, everyone, it's Thursday night and we're having some technical difficulties out where Nicole lives. Her internet service, there was a issue with weather, so it's down. And we're going live from our page. We still want to share with you on our topic that I just mentioned, find out how we get our patients to come in for regular massage appointments after the baby has arrived. So I'm Michelle Francis Smith. I'm one half of Perinatal Massage Therapy Education, and I am joined by Nicole Nifo, my wonderful business partner. So she's going to add comments, and if any of you out there are watching, you can feel free to add comments as well. So I think we'll just get started. We can be RMTs about this. You know, in our profession, we have to just roll with the punches. We get last minute bookings. We get, changes in people's health history, all those kinds of things. So, hi, Bhavani. Good to see you. So we're just going to roll with things tonight. All right. So one of the first things we thought we would identify are challenges. What are the challenges that come up for, pregnant patients or newly postpartum patients, why they don't book in for massage, especially in that first, let's say, 3 months postpartum. And let's face it, there's some really obvious ones. Having been postpartum 3 times myself, one of the first things is this, that you're overwhelmed, you're busy, you're tired, you're focusing on your baby, and it's really hard to focus on yourself when you're just trying to keep up with feeding, sleeping, you're counting how many poops and pees a day. So where is the time for self-care? So we know that that's kind of one of the major challenges. Another challenge is, how do you get away to have a treatment when you have a baby that's so young, who might be cluster feeding, feeding on an irregular schedule, having colic or fussy, struggling with attachment to mommy or their primary parent as they're adjusting, right? I mean, any of you out there, if you're listening, any of these challenges that you either personally experienced or your clients or patients have experienced when they're postpartum, feel free to just add them in there. So how do you leave your baby if you're going to have to leave your baby? How do you manage that, right? So fatigue, not able to focus on yourself. How do you leave your baby? Maybe you're struggling with some discomfort in your own body. So you need the treatment, but you can't really see how you're going to be able to get out of the house to get the treatment. So these are a couple of the challenges that we usually see. And Nicole, you are the best. You've taught me very well. So I'm just trying to keep up with my tech savvy co-pilot, Nicole. She's the one who knows how to do all this stuff. So um, let's look at some of the solutions. So I'll just describe my practice right now because it is very parent and baby focused. And even today, I have examples of how I've made this work. So I'm fortunate that in the space that I work in, Women's Health Physiotherapy Center, they allow and encourage parents to bring their babies to pelvic physio appointments and to their massage. So in our office, you hear the sounds of babies, you hear the sounds of parents, um, you know, you have the experience of it almost feeling like a midwifery clinic or an obstetrician's office. So it's very baby friendly. Even in that environment, sometimes parents feel a little bit self-conscious if their babies are criers or, fussy or anything like that. And we're always encouraging them not to worry about it, that we welcome babies and we welcome babies to be babies. So we're going to expect them to make sounds. We're going to expect them to be unpredictable. They're going to do what they do. So one of the solutions is creating a space, or maybe even certain days of the week or certain days of the month, where as a clinic space, you have arranged for baby family friendly time. Let me check out Nicole's comment. Nicole said, I had a patient tell me this week that her child is in the NICU, the NICU. So of course, if her baby is in the NICU, she's probably spending a ton of her time there. Her focus is there. So how hard is it to sort of pull yourself away to go get treatment? Maybe you're even feeling guilty if you're going for treatment. Yet, I mean, at this point, babies being supervised and monitored and taken care of, it's an excellent time for that parent to be able to come in for treatment and keep themselves going. I know a number of people right now who have had babies who are pretty sick in the first year, and they're spending all their time at the hospital. How hard is it for them to break away? Yet, if they do, it's really going to help keep them going, help them in their recovery, and help them be a better parent to their baby. Thanks, Nicole, for sharing that. Yeah, so back to our solutions. So that's one of them, having a baby-friendly space. But then, so what if you have that? What kinds of conversations are you having with your patients when they're pregnant? Are you actually setting them up for success in the postpartum period by actually getting them to book a postpartum appointment, or a few of them, before their postpartum? So this has been a skill set that actually, I'll be honest, I didn't have down pat before the last couple of years. Now that I'm in a baby-friendly space, that was a big step. But then I wasn't even used to booking people when they were pregnant into their postpartum phase. Today I had someone who's 35 weeks and it's her first baby and she's preparing for that. She's coming in for pelvic physio, she's coming in for massage. And this is her last treatment that she could book in with me, just because of the way my schedule is so far before the baby comes. And I said to her, okay, so you don't have another perinatal, you don't have another pregnancy massage booked, but do you have a postpartum appointment booked? And she was like, no, I don't. When should I book that? How soon after should I book that? I said, you don't know how you're going to feel after you have the baby, but if you need massage before you have your baby, you're definitely going to need massage in the postpartum period. So I suggest that you book something 4 to 6 weeks postpartum. You can cancel 24 hours. If the schedule doesn't work, the day doesn't work, you can change it, but at least book that appointment. You will be amazed at how much you will actually need it. And because the reminders come, we've got a great online system, so the reminders are coming. It'll keep you in your own schedule, which is so needed. Let me make sure I'm not missing any comments. Okay, I'm going to go back to the comments. Nicole says, like you said, creating an environment that allows them to bring their baby with them or another caregiver to join them at that appointment to help care for their baby while they get treatment. So that's another great solution. Sometimes people can't relax when they're in the treatment room if the baby's right there in the car seat or in the stroller. Like they're literally on the table and they keep lifting up and they're not able to let go. But if they knew someone was holding baby in the waiting area, if they knew someone was bouncing baby in maybe your common space of your clinic, they'd be able to let go. So that's a really excellent alternative option. Often grandparents come in and they are holding baby or, you know, taking care of baby so that parents can get that time. Okay, so we've already covered incorporating the baby into the session by bringing baby in, but you could also be incorporating the baby in encouraging that parent to book a treatment session for baby and for themselves. Some parents that I know, they just can't put themselves first in that first period of time. They just find it so difficult to focus on their own needs and their own health. But when I suggest, okay, why don't you do a mommy and baby session? And they're like, what's that? And I said, well, basically, it's 2 back-to-back sessions. One is for you, one is for baby, one is for baby, one is for you. We always gear those appointments based on baby's temperament. So if baby is alert and fed and happy, then we're going to treat baby first, followed by the parent. If baby is fast asleep, then maybe we're going to treat parent first and just take advantage of that full hour for the parent to get treatment. So we could be incorporated by having baby come attend the session, or we could be incorporating by having baby actually a part of the session. What else can we do? Let's see. So talking about and educating our pregnant patient about their pelvic floor, what their pelvic floor does, and the changes that they're likely going to go through during the pregnancy and delivery is a really great way to help them see the value in booking that appointment postpartum, right? So it's not about scaring them, but it's really about educating them, because not many health practitioners are actually talking to them about their pelvic floor and what they can expect. Okay. Yeah. So all of this education, if we start doing this before the baby comes, then pregnant patients see the value in booking a postpartum massage. And it's not that they don't see the value when they're postpartum, they're just too busy, too tired, maybe too overwhelmed, and maybe bogged down with too many other appointments related to their health or the baby. But this way, it's really setting them up for success, as I said before, to be active in their self-care plan, so that they're a part of their plan and they're empowered. They're really, really empowered. So I'm curious to know out there if there are any other comments or thoughts, like what have some of you done? Hi, Chelsea. What have some of you done in your practice to make it more encouraging, or to get your postpartum patients coming in for massage, especially in the first 3 to 6 months, or 0 to 6 months? Because we do know that we'll often see them a year later. They're just about to go back to work if they're working, and they've got so many things going on with their body that they haven't given any attention to really during that postpartum period. And then you're trying to tackle them all at that time. And I find in those treatments, patients will say, if I had only known, or I really wish that I had done this. So I decided a while ago, like, let's create an environment so that there's no regret. I'm giving them this information before they're asking for it. I'm giving them this information that they wouldn't even know to ask for, because you don't know what you don't know. And then creating a plan. Really thinking about creating a plan. Yeah, so that's really some of the points that Nicole and I wanted to share with the group in terms of really how to get your patients booked in for postpartum massage. after the baby has arrived. So if you have any comments, if you have a chance to listen to this or watch this later on and you have comments, feel free to add them. And if you have any questions for us or you have further topics on this topic, you can also feel free to send us a message privately or add to this thread. I'm just going to go back and see some more comments. So a couple more. I think letting new parents know that they can bring baby with them is great. Lots of people don't know that's an option. I've gotten good at rocking a carrier with my foot while treating mom or dad. Haha. Totally can relate. I know Nicole can too. Nicole will sing to babies. Sometimes I'll do some singing too, but definitely I have this like memory of head, neck, and shoulder, or like working the upper back and using my foot to kind of tap the car seat. I've also recently in my clinic, just to let you know, there's this thing called a glider. It's like square. It's brown. You can order it on Amazon. It's very old and it's battery operated, or I think you can plug it in with an adapter. And basically what it does is it goes zhoosh, 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 zhoosh. It's flat and it has like 2 panels. So it moves like this. And it's made for you to put a car seat on top of it. And it has these 2 hooks that hook on the side of the car seat. And it basically just glides the car seat. I've had success with it the 2 times that I've used it. There was one time that I used it that I think the sound of it, like the zhuzhing sound, the baby was not impressed. So she was like going, and then she kind of just like, what is this? And started crying. So we turned it off. And actually after a few minutes of just turning it off, she fell asleep. So the sound she wasn't too impressed with. But it was good because now I wasn't kind of distracted by using my foot to rock baby, and I could really just be present for parent, and parent was happy because they knew baby was fine. So maybe something to look into. Nicole says, common that patients want their body back, but don't realize they need some treatment before starting an exercise routine. Okay, so this is a really key piece of information. And I'm actually dealing with this right now because some of my colleagues, patients, friends who have been following me on my 100-day fitness and health challenge have said, they want to join in. And a few of them were kind of at the 6-week postpartum phase and not necessarily familiar with pelvic health and pelvic sort of assessment. And I was saying, that's great. I'm so happy you're feeling good and that you're wanting to get more active. And I would love to get active with you. And I think it's important not to do it before your body's ready. And how would you know if it's ready if you aren't having an assessment? Come in, have a pelvic health assessment. Come in and have a massage, because my postpartum massage has a lot of questions that are geared towards finding out how you're doing. So, and finding out what's happening with your hip flexors, what's happening in your gluteals, what's happening in your adductors and your low back, and basically setting you up so that your core 4 are strong enough and supportive enough to be able to do the work. And that assessment really is mainly done by the pelvic physio in my space, and then I do supportive work to kind of assist with that. So I'm glad that Nicole mentioned that. Also, instead of getting the okay from a doctor, we should set the standard of getting them assessed by an RMT and pelvic physio before starting exercise. So remember, an obstetrician, a midwife, what they're looking at when they say you're good to go is, if you had maybe some tearing, or you had an episiotomy, or maybe you had some issues of like stability, systemic, those kinds of things, life stability type of things going on during your delivery or your pregnancy, they're looking to make sure those things are in order. They're not necessarily doing assessment to kind of see what is your pelvic floor strength like or tension like. Are you ready to do exercise? So sometimes they're saying, you're good to be sexually active again. If you're feeling good, you should be active. But it's not necessarily their forte or specialty to decide what types of exercises you should do and how soon you should do them and how fast you should do them. So while we love them They have a huge role and a key role for the patients that we treat. It is important, as Nicole's saying, to do that next step. So you've gotten the green light from your doctor, so you know in terms of your stitches or your uterus involuting, it's gone back into the right place. All of those life stability type measurements are in good order. Great. Now come and see a pelvic physiotherapist. Come and see your perinatal massage therapist. And let's just see what the rest of the picture looks like. So thank you, Chelsea. You were saying, what? That's super cool. Well, so are you, and thanks for joining. And then Nicole was replying. She said it's on Amazon. She found it. So what did you find? I think I might have missed part of this. Instead of getting it from the doctor. Yeah. Okay. Hi, Renata. So nice to see you. It's been a long time. And then Nicole says, some patients don't even get internal vaginal assessments, so don't expect them to inform a patient or empower them with anything else than a Kegel. But we know a Kegel is not what everyone needs. So I know not everyone listening knows this, but Nicole has done some additional training in pelvic health. I have now been exposed to a lot of this in my practice and through working with Nicole and the courses that we teach. And it's important to remember that a Kegel, us just saying, because we've heard about a Kegel, oh, you're postpartum, you should do Kegels. You actually could be telling people to do something that isn't advisable for their body. It isn't ideal for their body. If we as massage therapists know we can't do an internal assessment, and if we know that the patient hasn't had an internal assessment, then we don't actually know if what's happening with their pelvic floor is that it's actually weak and needs to be strengthened, or it has areas of tension or tightness or even trigger points. This is why we suggest all massage therapists. This is why we're suggesting everyone in our lives to have a pelvic floor assessment. Don't be afraid of it. It's not painful. It's really gentle. It's actually a lot more comfortable than going and having, an annual pap smear with your doctor. And it tells you a lot about what's going on in your body. And you can also learn about places like far away from the pelvic floor that are actually affected. You often will feel the effects. So keep that in mind. Okay. Yes, that's right, on Amazon. The whooshing carrier on Amazon. That's it. Yes, about the glider. Sorry, Nicole. I completely had already forgot that I had mentioned that. You see how my attention span is. So yes, that's right. The Amazon, if you go to Amazon, you will find the glider. We now have 2 of them in our clinic because the first one was working so well. And because there's usually like 3 or 4 practitioners working at the same time, we needed to have a few available. So we're just in the last couple of minutes here. If there's any more comments, feel free to add them. But I just want to thank those of you who've come on and are watching, listening, and those of you who've commented. I want to say a special thank you to Nicole as well. She has been such an inspiration on everything perinatal for me and has really enlivened my passion for the work. It's so great to have a colleague who has a similar vision for all of this and a similar passion for educating and sharing and spreading. And if it wasn't for her, we wouldn't be doing these lives every week. She has been so consistent and really a powerhouse. So I just want to give her a shout out to my girl, Nicole. And I want to shout all of you out who are watching and listening and have been supporting every week, who've taken our training in the past, who recommend our training. And we have lots of great things coming in 2019. So just keep up with us, stay up with the topics. Let us know if there's topics that you want us to speak about. And we're always happy to integrate what you're looking to know more about with all the things that we're passionate about sharing. Okay. Oh, Nicole, love you, girl. All right. I think I see one more comment though from you before let's just read this and then we'll finish off. It's important for our MTs. Do you have the confidence to speak to your patients about their body, even though There are areas that we may not necessarily treat, empowered with that information and building a relationship with them to keep them coming back. So, I mean, really, as Nicole's saying, even though we don't have it in our scope of practice to treat internally structures of the pelvic floor, do you feel empowered to share, learn, first of all, and then share with your patients some of the changes they might experience in their pelvic floor, regardless of the fact that you won't work directly there? Do you have a referral network set up so that you can actually send them to a pelvic floor physiotherapist? And do you have the skill set to be able to then do the external work that we do have license to do, and help your patients? So it really just starts with you. I think that's something that I want to end with. It really starts with you. You are a wealth of knowledge. You are an expert, even if you don't have tons of experience. You've done the training to become an RMT, and now you can just add to your skill set. You're the one who has that background. So take advantage of sharing what you know, and what you don't know, get in the know, right? Talk to us, talk in our community, join the Pregnancy Massage Therapist Canada if you're not already in the group, and keep the learning happening, because you could be changing the entire way a person parents because they're empowered in their body. You could be changing and transforming their experience of their body postpartum. You could be improving their sex life. You could be improving their activities. You could improve their ability to work, if they want to go back to work. So it starts with you. I want you to have a great night. We'll see you next week, Thursday at 8:30. We're here every week, and we'll let you know what the topic is during the week. Take care, everyone. Have a great night. See you then.